Hi everyone, I am Rochelle Ethan, and I am here today to talk to you guys about some child health advocacy and injury prevention. A little bit about me, I work for the American Family Children's Hospital here in Madison, Wisconsin. I have been here now for almost 12 years. Time goes by really fast, so it's been really fun and really interesting. I just want to give you all a different perspective on some of the things or possibilities of career paths for you in the future. So just talk a little bit about the organization that I work for. What is child health advocacy, and specifically what it is that we do. We have community programs and stuff that we implement, and also hospital-based programs that we work on. So this is the hospital that I work at, and MJ. We both work at this wonderful organization. There's a beautiful picture. Oh, what?
And it is wonderful.
It is wonderful. Here is the outside picture. If you look inside, it's very friendly, a great atmosphere, really wonderful things. But I also wanted to show you specifically my office location. So I coordinate programs out in the community, and I run the Kids Safety Education Center for the American Family Children's Hospital. And if you look below, you can see the big picture of my office. Anybody have any ideas where my office is located, like what type of building that is? Well, if you guessed a fire station, you are absolutely right. My office is located in a fire station. There are 11 of us on our team, some that are based out of this location and some that are based out of the Children's Hospital specifically. A lot of our backgrounds are health education or community health. Some of us have our master's in public health. Some of us have degrees in communication. We also are very bilingual, so we have Spanish degrees, and then we also have individuals who maybe speak Hmong or are doing some social work stuff. So why do we need injury prevention specifically? Well, 1 out of 10 kids experiences a non-fatal injury each year. So think of 10 kids that you know, 1 of them will experience a non-fatal injury each year. That's a lot of kids. And despite the evidence that prevention saves lives and reduces healthcare costs, there's really not a lot of money spent on preventing child and adolescent injuries, especially here in Wisconsin. Wisconsin, the annual spending on injuries is about $3.9 billion. That's a lot of money. Some of the things that we're looking at and how we can work to have better health outcomes specifically is looking at like our policies and our health factors. So our policies and programs might be some of our large like laws and additional things that our lawmakers can do. Some of our health factors looking at, you know, our environment health, our social economic health, our clinic, and our behavioral health. So all of those health factors go into creating better health outcomes for individuals. So injury prevention programs themselves specifically are programs that reduce injury-related mortality and morbidity through implementation of evidence-based, population health-driven programming and advocacy work. There's a lot of really awesome things that go into injury prevention, a lot of time and evidence that we work on to be able to create programs, to be able to do things so we can help our communities. So one awesome program that we have right here in our community, and I'm sure maybe in your community as well, we have the Safe Kids Coalition. It is a coalition of individuals that come together to educate children and families. They provide safety devices. They're the advocates who help to discuss stronger laws. They campaign for different social norms, and they also help fundraise for injury prevention programs. Anybody have any idea what type of individuals might be part of this collaboration or coalition? Some ideas of people who might be on there? Tom, if you're still on, I know you can talk.
Firefighters, police officers, health educators, you name it. Anybody that has to do with keeping kids safe can be part of the coalition.
Absolutely. What about kids? Do you think kids could be on this coalition, or teenagers?
Yes, because they're a valuable resource to find out what is actually going on as time changes. I know that the injuries that were happening back when I were younger, probably not the exact same thing as technology has improved. So those injuries have kind of gone away, but now there's a whole different one that, someone that's older like myself isn't going to be able to, relate to that sort of stuff. So it's good to get the younger people involved so that we know how we can help them.
Absolutely, that's absolutely correct. When generally we have individuals that sit on coalition work together, it's always nice to have students or kids be involved as well, so we know that we're making decisions that are actually going to be beneficial for them, right? So I think this is a good thing. So if students are interested, please reach out to your coalitions. So this is what our coalition looks like in our area specifically. And like Tom said, we have law enforcement, fire, EMS, health and safety professionals, our schools. We have a lot of private organizations that also are part of our coalition. And basically those individuals help us with fundraising and additional things that way. And then again, hospitals and clinics. Some examples of our programs, probably our most robust program is our child passenger safety. We have an infant safe sleep program that basically helps with infant mortality. And then we have safety that is geared specifically for children, the education that we actually give kids. So we have a Safety Town program, Impact Teen Driver programs, and we also have some health and well-being programs for teens specifically, and that's really around like their mental health and well-being. So a little bit about our child passenger safety. To become a child passenger safety technician, the class actually is about 4 days long. So you sit in a class for 4 days and you learn all about child restraints, specifically how to install them properly, what they look like, all the parts and pieces to them, and then different vehicles. They really examine how seats should be installed in their car, and each car is so different. So it really takes a long time for our technicians to be trained. And then even once they are trained, sometimes they're kind of like, oh goodness, there's still a lot to know and a lot to remember. Some things that I think are really interesting specifically for this group, since that we have kids from all over that attend here, there are different child passenger safety laws in every state. So I think when parents are trying to, find the best restraint for their child or put their child in correctly, sometimes if they're in Wisconsin, maybe they're taking a trip out to Colorado or they're going to Pennsylvania, or whatever it is they're heading, they have to be aware that the laws for child passenger safety in each state differ. And so we really work with families to find the best recommendations, the evidence-based practices that really help keep kids safe across the board. And so we've created flyers and additional things. And these are really what our partners all across our nation, other hospital systems that we work with, to promote and work together so that way we are all promoting the best practice safety recommendations for families. I think it's interesting too, especially areas where it's cold, obviously Wisconsin, and we have a lot of snow, that making sure that you're installing your child in their car seat when it's cold is a little bit different than installing your child in your car seat when it's warm. So kind of just knowing all the parts and pieces make that a great program. Our Safe Sleep Well program is also really wonderful. It really talks with families about how they can share their room and not the bed. We encourage placing a safe sleep environment next to a bed at night and not sharing a bed surface with a baby. And we really educate on just one infant in the crib with a firm mattress and keeping a fitted sheet in there and nothing else in that surface. We also write grants and provide families with safe sleep surfaces. So we provide pack and plays and other materials for them. So that way, if they're unable to purchase those items on their own, we're able then to support that and give them those items. We have a phenomenal program called Safety Town, and there's a lot of safety towns throughout the nation. So there might be one in your community as well. And our program specifically is a program that is designed for children who are entering kindergarten. So we have a curriculum specifically based for them. We sing songs, we do hands-on play, and it's all about injury prevention. So basically teaching 4 and 5-year-olds how to wear their helmet correctly, how to cross the street and cross the street safely, how they should ride in a vehicle so that way they are helping educate their parents or other family members as well if needed. I think it's a pretty fun program. There's a lot of song singing, mascots, and it's a really great community collaboration. A lot of our community partners come to this program as well and help facilitate some of the presentations for us. So it's a very fun program. We do a lot of bike and pedestrian safety. A lot of what we do currently, though, is geared for, I would say, elementary age students. We read stories to them at school. We'll go in and show them how to fit bike helmets. What you're seeing here is pictures of our walking school bus. And what a really cool thing for us is that we are connected with the University of Wisconsin. So the bottom picture has a lot of like our athletes in there. And if you look closely, I don't know if anybody who was on this call today is a Badger fan or potentially a Pittsburgh Steelers fan now. But Derek Watt, number 34, he is a professional athlete right now, and he was on our walking school bus team. So we think that's pretty cool too. Some of the other programs and things that we offer or what we do and collaborate with delivering fire prevention. And I don't know if Tom, if you're still on, if you want to talk about the program since it is a collaboration with the Oregon Fire Department.
Yeah, so what we did a number of years ago is we wanted to make sure that everybody had working smoke detectors in their home at the Oregon Fire Department, the Oregon community. So we came up with a program that allowed us to go in and check these smoke detectors, make sure they're working, and we did it in a way that would be fun for everybody. So what we did is we teamed up with our local pizza pit, and the biggest reason is because Pizza Pit is basically right out the fire department's back door. So it made it really easy to, drive around the fire station and park between the two buildings. And then we sat outside and waited as orders would come in, and we would deliver the pizzas in the fire truck. And then while we were there, we had some people show the kids the fire truck. And then we went in and educated the parents on smoke detectors, making sure that they're tested once a month, batteries are replaced every 6 months, and then made sure the parents knew that every 10 years the whole smoke detector itself needed to be replaced because they're only good for 10 years. We've been doing that program for a really long time. Typically, when we deliver pizzas, we're probably about 60 or 70 pizzas that we deliver in a night. And when I mean a night, it's for like maybe 3-4 hours max that we're out. So we hit a number of our homes in our area. It's become very popular. A lot of fun.
Yes, it's a great program. Our collaboration with it is also obviously the fire prevention piece, which we want to keep kids safe in homes. We also give out reflective materials because usually this program is in October where it's fire prevention month. And so we give out different things so that way kids are safe and seen during Halloween. So we get reflectors and different things that way. On the bottom, you can see our car seat recycle day photo. How many of you knew that car seats expire?
Not me.
Right. So it's interesting because car seats do expire. So depending upon the brand of a car seat and what the car seat's made out of, on average, car seats last about 6 years. And so we tell families that usually depending upon the seat, that at that time, the car seat is no longer going to be safe to use. And it's ultimately because if you think about leaving that car seat in the car, it gets hot and it gets cold. Plastics and the materials that that seat's made out of, as time goes on, it's not going to hold up in a car accident. So some seats are made out of steel, and those seats have a longer expiration date. But generally, on average, most car seats expire in about 6 years. So what we do is, in order to get families having safe seats, we will collect the seats and work to recycle the parts and pieces of them. It's gotten a lot harder as time has gone on because of the different recycling companies not wanting to take the plastics or all of those pieces. But we would try to focus this recycle event right before garage sales. So we would ask our community, share this information and say, let them know that car seats do expire. If they have an expired seat, they could bring the seat to us, and then we would take the parts and pieces off of it and recycle what we could. It's a great event as well. And then the other picture here, we have kids, cars, and heat, especially in the state of Wisconsin. July and August tend to be our hottest month. And so we try to do the best that we can to educate on how hot vehicles can get. On average, a vehicle gets increases the temperature in 10 minutes about 20 degrees. So we'll tell families, and this is just a really great thermometer, a really great visual for families to see, that sometimes they're like, oh, if I'm just going here real quick, or if they leave their dog in the car. This is just a great thermometer that will show families and just bring that awareness that, hey, you know what, it's 82 degrees outside, but wow, it's, the thermometer has been in here for 10 minutes and it's already 114 degrees inside that vehicle.
And that was actually done, as you could see, at the Oregon Fire Department. So when I put that up there, that was within a few minutes that it got up to 114 degrees. I left it in there for, I don't know, maybe an hour or so. And the final temperature that it reached was 140 degrees. So that's 140 degrees is pretty warm inside of a vehicle that's closed up like that. Now, think about, being in that vehicle or leaving your pet in that vehicle or a small child in that vehicle that can't get out of the car seat. Obviously, it's not a good environment for them.
Right. So again, one of the things that we just do to be able to raise awareness and show families, hey, this does happen. It gets really warm. So do the best that you can to kind of be attentive and be aware. Now I'm going to switch base a little bit here and talk about some of our hospital-based programs that we offer at the Children's Hospital. So inside our Children's Hospital, and I was going to take a tour of it today, but unfortunately with COVID, things have been closed and they're starting to ship material. So they had a lot of boxes and other things. I just didn't feel like the environment was very clean for you guys to look at. So I'm going to talk to you about it instead. There's a store inside the hospital that sells safety products for families. And they sell these products at cost or at low cost. So they don't make a profit on anything that they sell. The hospital employs the staff to do the education, and then we just purchase the items, and then we sell the items for what we purchase them for. So there's a lot of different products there, depending upon what you're looking for. And it's not just for children. We do have, fire extinguishers, smoke detectors, life jackets for adults, bike helmets, ski helmets that also go to adult sizes. So it's one of those stores that really works well to make sure that we're keeping not only kids safe, but those individuals who are taking care of those kids safe as well. I don't know how many of you ride bikes or you see individuals or families out riding their bike and you see that every kid has a bike helmet on, but not the parent. So we really try to do a really great job of letting them know that mom and dad's heads are just as important as theirs and making sure that they're doing what they need to keep safe as well. Then also inside the safety center, we have a back room that's specifically designed for kids with special healthcare needs. So sometimes, let's say if a kid were to break their leg or break their hip or need a surgery of some sort, they still have to get home safely. And so car seats and different things that our technicians are trained to be able to use and show families, so that way their child can still ride in a car seat safely even after a hip surgery or something like that. We work with OTPTs at the hospital to make sure that we are doing the best that we can for each child. So here you can see this is a hip spica cast, and so this is the hippo seat that we use for families there. And then there's a seat specifically that basically for infants that have or that fail their angle tolerance test, and so that in order for them to leave the hospital, they have to lay flat versus kind of upright in an infant carrier. So a lot of great things, a lot of things that we work with families, so in case a situation were to arise, we can help them and transport them safely. And we also work on some programs specifically that are focused on, unfortunately, intentional injury. Majority of the programs and things that we focus on are unintentional, things that maybe were preventable, but definitely things that we weren't quite sure. And we also help, the hospital also does focus on things that are intentional. So we really work with families on education on the normal crying patterns for infants. And we educate on the evidence-based program called the Period of Purple Crying. If anybody's interested in taking that training, we can offer that training to you as well. It's a great training if you're planning on doing any babysitting or going into the healthcare field. It's great to know about. And basically it kind of talks about the period in which, you know, kids cry, that it's unexpected, that sometimes, you know, they resist their soothing. And it's really just helpful to know that this does happen. There's a curve that goes along with it. And, you know, some really phenomenal soothing techniques for infants. So that way we can help reduce abusive head trauma in children. And then our hospital also is a no-hit zone. So throughout our system, we have a policy where you're not allowed to hit a child in our hospital system. So if we see actions or situations where potentially families are getting escalated, or we're seeing situations, we have what we call like these care kits that we can give to families to kind of, you know, reduce some of the stressful situations that they might be going through when they're at the hospital or if they're in a clinic, to really work on making sure that everyone's staying safe and doing the best that we can. We also are working with our social workers in the School of Social Work to educate different communities. Currently, in my area specifically, the community of Stoughton is a no-hit zone. So there's different parks and areas throughout the community that have no-hit zone signs up, and that the community is educated to intervene or work with families if they see a situation that makes them uncomfortable when it comes to potentially, you know, spanking a child. So I do have a quick assignment for you guys this week, potentially if you're looking for something to do. I was wondering what types of injury prevention programs exist in your community. Are they similar to the programs that I talked about today? Are there things that maybe you would like to get involved in? That would be something I would like to know, because ultimately when we look at things that we're doing, it's nice to know what other areas are doing and how we can help support and make an impact definitely in our communities. And then I have one last thing that I'd like to leave you all with. This is one of my favorite pictures. Basically it says, baby gates make every house safer. And so you can see on the bottom of those stairs, there's a gate placed across that, but then you see those two little kids climbing up the stairs along the side, which obviously does not look very safe. So one of my favorite pictures. And then lastly, does anybody have any questions or anything else I can go over and answer?
Nope.
That looks like my grandchildren. They would do that.
I know.
It's amazing what children can figure out. They have such wonderful brains.
Yeah, they're really good at different things. And so we always try to tell families too that, you know, it's not as easy as just, you know, putting up a gate and making everything safe. Like, that's not the way it works, unfortunately. sometimes kids will find a way, and it's really doing the best that we can to educate families, you know, in supervision to make sure that we're doing the best we can to keep our kiddos safe.
Great. Yeah, and let's see. Damien says they're his little brothers.
Exactly.
Yeah. So what education would you recommend for our ready campers to actually consider if they're looking to go into, or even, you know, like any educational things? I know you're going to be talking on Thursday too with us, but educational opportunities that the ready campers can be involved with, you know, like in middle school and high school, and then as they prepare for college.
Yeah, I think for me specifically, like just kind of being aware and knowing. So depending upon what your interests are, if you like to babysit, all of those things, having a great knowledge of children and, you know, how they cry, all of those things are very valuable in trainings that we can give. The child safety one I probably wouldn't recommend because it's very intensive. But definitely it's good to know that the different laws exist depending upon where you are. So if you ever have to transport a child, you would be able to transport them safely, or at least know the recommendations for each seat. This week we are talking a lot about some really phenomenal things, and right now currently, like the majority of things that we talked about today were for little kids, but as the week progresses, the Impact Teen Driver program is really awesome. I think something that you guys will get a lot of great information out of. And then on Thursday, we're going to talk about QPR, question, refer, or persuade and refer. And so basically anybody who has, you know, is struggling with anything mental health wise, it's a great thing that you can then take and just be prepared to help anybody in any situation. So I think that would be phenomenal. As far as those individuals, depending upon what you're thinking about doing in the future, and I know that obviously this is a little bit different than things that you've been working on, or at least knowing about so far, I think it's just knowing that these organizations exist. And that way, let's say someday you do become a firefighter or you do become a nurse or whatever those things that you want to do, there are individuals out there who would love to partner with you and work with you, because ultimately we can't do this alone, right? Like if we're going to have an impact in our community, prevent injuries, and keep our community safe and healthy, it's going to need to be a collaboration. So I think those are some of the things that I would recommend, and just knowing, you know, what's out there in your community. So that way, if there's something you're interested in, you can help do.
Okay. And in thinking about your job, what do you find the most valuable, or what can you explain one of the situations where you just found it so rewarding in your position to be able to help children?
Yeah, so I think a couple of things. For me specifically, one of the things I really enjoy is the data piece that we get. So we have a trauma manager at our organization who helps us run the data, and we can see in almost real time why kids are coming to our hospital. And so with the COVID-19 currently, we're seeing a lot more kids coming because they're falling out of their windows. We're seeing a lot more kids on bicycle accidents, and seeing a lot more kids, not necessarily in car crashes, but more pedestrian, because kids and families are outside doing things. And so I think those things are really, then we can tailor what we're working on and how we can educate our community and help our community partners to make sure that we're doing things that's relevant to them. Some of the most rewarding things I think for me specifically is helping a family, talking about some of the things that maybe they were unaware of. When we see families, like my hospital is not a birthing hospital, so we don't see babies being born here. So families choose to come to us with their infants. And I don't know, I'm a mom, and I know that obviously you guys are young, but someday, like how tired families are in their infants and how exhausted families are, and just help them walk through and navigate those things sometimes is really, really rewarding. And to give them that encouragement that, you know what, this too shall pass. Your baby will grow. You're going to keep babies safe by doing all of these wonderful things. So I think it's just, encouraging parents and making sure that they're doing the best they can. That's all they need to do.
Anyone else have any questions for Rochelle?
Nope, thank you.
Yes, thank
You're
you very much,
welcome.
Rochelle. Excellent.
Yes. I'll look forward to seeing you guys all this week. I'll hopefully hop on here and there. If anybody at any point decides they have any questions or they like more information about some of the things that I do or some of the things that other maybe hospitals do, please let me know. I don't think when I was your age, I knew a job like this existed.
Mm-hmm.
I think that's been really fun for me to kind of figure out, where I was headed in life and things I like to do. And this has really been something that I thought was fun and informational. And so if there's any questions that I can help, definitely let me know.
Thank you.
All right.
Thanks so much. All right. So I'm actually multitasking and talking with the presentation for tomorrow. And so it's going to be a surprise. So I'll be sending out the information later today about what we will be talking about tomorrow. And Damien says, I need to watch the first 16 minutes, so that's okay. That's a good thing. Good deal. Anyone else have anything else to add before we leave today?
Nope, thank you so much.
Okay, and Damien, I will post it to the, he wasn't on time, so that's fine, Damien. You can always watch it again and be ready. So I will be posting both this video and also Friday's video, and all the others are up there. So, okay. All right.
All right.
Have a
Thank
great day.
you.
We'll talk to everyone tomorrow.
Bye.
Bye-bye.